There are 3 types of blood cells. The first one is your white blood cells, and those fight infection. So they will decrease while on chemotherapy. Your lowest point will be about 7 to 14 days after treatment. And we call that a nadir. And a nadir is just a Latin term for lowest point. Maybe you'll hear your doctor or your nurses talk about your nadir visit. And that would just be bringing you back into the clinic to make sure that your white blood cells are at a high enough level. A little bit about your white blood cells, there's something called a neutrophil, and that is your frontline defense to fight bacteria. So these numbers are important. So we just want you to know that each time you're coming into the clinic, we will be taking blood either from a blood draw from your arm, or some patients do have ports. So we will use those each time you're in the clinic. Another type of blood cell that we are concerned with would be your red blood cells. And so those carry oxygen, and chemotherapy affects these blood counts. So they do decrease over time. You may experience things like fatigue, shortness of breath. So if it becomes severe and you are having a lot of shortness of breath, we would want you to call the clinic. The third type of blood cell that we are concerned with would be your platelets. So platelets are in the body to help with blood clotting. So you can see that this is very important. So if you're noticing bleeding that's not stopping, those are things that you need to be calling your doctor for.